I'm in practice as an internist and a cardiologist. I'm board certified by one of the major boards in the United States, but I'm also trained in epidemiology. I trained at University of Michigan, and epidemiology is the study of the distribution and determinants of disease. It's the discipline of evaluating diseases as they arise in populations.
That's great. What were your concerns around early treatments for COVID-19, what you were seeing?
Well, maybe John can kick it off by explaining what we heard was the narrative about the virus.
It became apparent to us independently when this first happened. We weren't in contact. We only discovered later that we were neighbors. But both of us were impressed by what seemed like a kind of classic narrative of a monster is coming. A boogeyman is coming, and he's coming for all of us. It's a respiratory viral illness emanating out of Wuhan, China, and boy, is it deadly, and there's no distinction between ages or fitness or anything. It's coming for all of us, it's deadly, and all we can do is obey whatever mandates the government presents us with based on official public health directives. I think one of the things that we both observed very quickly is, on the one hand, this was represented as a novel coronavirus. At the same time, our federal health authorities seemed to already know everything there was about it. If there were independent doctors in the field saying, well, I'm looking at this, I'm treating patients, I'm finding that certain combinations of drugs take the edge off of this, our federal health agencies immediately said, no, nothing works as a therapeutic. All we can do is stay at home, wear masks, social distance, and wait for a vaccine.
Or until we're so sick we have to go to emergency.
Well, I should say that the first thing was we have to wait for a vaccine. If you should fall ill before a vaccine, the heralded savior vaccine, arrives, the attitude was pretty callous. It was, well, sorry, there's nothing much we can do for you. If you get really, really sick and can't breathe, then go to the emergency room and we'll kind of do the best we can. But there was no attempt to offer any kind of hope, or it was almost like, and I think you had the same perception, it was almost like those who fell ill before the arrival of the heralded vaccine, it's almost as if the intention was precisely that they should feel despair. They should feel hopeless. There's nothing that can be done.
Or in fact, they should be sacrificed. I mean, this is a terrible thought, but I can tell you as a doctor, all forms of pneumonia should be treated immediately at the first day of illness. So we always treat all forms of pneumonia at home. There's not a single form of pneumonia that we would say, wait at home for many days. In fact, on average, it's 2 weeks before people are sick enough to come into the hospital. It violated every aspect of good clinical practice.
And every illness, early intervention, right? That's what we treat. Yet doctors who used early intervention treatments were demonized.
Well, the doctors who attempted to use empiricism, that is to make observations, and what we had done with the published McCullough protocols is find groups of different drugs or agents that could be organized into a sequential protocol based on signals of benefit, acceptable safety, and our empiric observation. Doctors who tried that, they were censored quickly. There was severe professional reprisal. There was a delicensing, and people lost their jobs.